Hello, good afternoon, everyone. Thank you all for joining us. I see it's 2:02, so maybe we'll get started. I see there's still some people joining. We're over 100 right now, but I think everyone's slowly making their way in from the lobby. So I will kick us off in the interest of time, but we'll go through some housekeeping first, so there is still some time for everyone else to join. So I'm going to share my screen to get us started. Okay. Okay, so thank you all for joining again. We're really excited about this webinar to discuss the really important topic of a World Health Assembly resolution on rare diseases. The webinar is, of course, co-hosted by the Arab Republic of Egypt, the State of Qatar, the Kingdom of Spain, and RDI. And we're very, very grateful for the presence of all the member states here today and their support in championing this important resolution. Just before we get started, I'm going to go over just some basic housekeeping. So it should be possible on Teams to change your display name. So if you'd like to add your name and your organization, that would be great to help us to identify people. The webinar is being recorded, so please keep that in mind. And if you have any questions throughout the webinar, we invite you to use the Q&A function. If you just have comments or would like to introduce yourself, you can use the chat as well. But for questions and answers, the Q&A function works really well. And we also ask you to keep muted unless you're called upon to speak, in which case you should be able to unmute yourself and we'll invite you to do so. Lastly, if you'd like to activate captions, that's a feature in Teams to help with accessibility as well. Okay, so as a brief overview of the agenda for today, we'll begin with some opening remarks from RDI, Rare Diseases International. We will then hear from the member states that are officially co-sponsoring the resolution and co-hosting this webinar. And followed by that, we'll hear the perspectives from a few key stakeholders in the rare disease ecosystem. After this, we're happy to have a panel of RDI members, so we'll hear from them what this resolution will bring, to their communities and their organizations, and what difference it will truly make. And lastly, we'll hear some reactions from a few rare disease champions that we're privileged to have with us today as well. And then we'll open it up for general questions from the audience if time permits. Okay, so without further ado, I'm pleased to open the session and I will pass it over to Rare Disease International CEO Alexandra Humber-Perry to deliver some opening remarks.
Thank you. Dear colleagues, RDI members and partners and friends, it's a pleasure to welcome you to this important webinar co-hosted by Rare Diseases International, the Arab Republic of Egypt, the State of Qatar, and the Kingdom of Spain. And it's extremely encouraging to see so many attendees, so thank you. We are gathered today at a pivotal moment for the global rare disease community. Our focus is on the proposed World Health Assembly resolution on rare diseases planned for the WHO 2025. This is a member state-driven initiative led by Egypt and co-sponsored by Qatar, Spain, and Malaysia so far. Although the resolution is yet to be passed, I think the discussion we have today are crucial. Our goal is to build the momentum and consensus needed for this resolution to gain the necessary support, leading to its successful adoption hopefully in May 2025, and the subsequent development of a comprehensive global action plan to ensure impact at country level for the person living with a rare disease. To this end, we are fortunate to have today with us distinguished representatives from the co-sponsor Ministries of Health, Egypt, Qatar, and Spain, alongside RDI members, World Health Organization, research institute, and private sector representatives, who will share their insight on how can we collaboratively drive this initiative forward. For the rare disease community, I would like to highlight a few points. This resolution is a unique opportunity to bring rare diseases to the forefront of global health policy. But most importantly, it's about translating global commitment into impactful actions, and this through the development of a global action plan on rare diseases. This is urgently needed now, as you know, to address the significant disparities in care, research, and policy that currently exist still across the world. Despite affecting over 300 million people globally, rare diseases often remain neglected in national health systems, leading to delayed diagnosis, limited treatment options, and inadequate social support for those affected. So a coordinated global action plan would provide a strategic framework to harmonize effort, mobilize resources, and promote collaboration among countries. It will also ensure that rare diseases are integrated into universal health coverage strategies, fostering equitable access to essential services and driving the development of innovative therapies. So on behalf of RDI, I want to thank each of you for your dedication to this cause, and in particular today, Egypt, for having initiated this resolution, and the co-sponsor countries, Qatar, Spain, and Malaysia. We call now on all member states to co-sponsor the resolution. And your participation as a community and your commitment is critical to bring this resolution to life at the World Health Assembly the 2025, but also beyond, to ensure that universal health coverage truly includes rare diseases and that all persons living with this condition have access to the care and support they need and are better recognized, supported, and engaged. So we often say, while we may seem few, we are many, but we are united by a common purpose, is to create a paradigm shift in how rare diseases are perceived and addressed in every country. And this World Health Assembly resolution provides that unique opportunity. So thank you, and I look forward to a productive and inspiring discussion.
Wonderful. Thank you, Alexandra, for those remarks and setting the stage for what's to come for the rest of the webinar. So without further ado, now I'm happy to welcome our member states to provide us with some opening remarks and perspectives from each of their states. So first of all, to start, I'm honored to invite Dr. Mohamed Hassani, the Assistant Minister for Public Health Initiatives within the Ministry of Health and Population of Egypt, to deliver opening remarks and provide the perspectives from Egypt. So Dr. Hassani, over to you.
Thank you very much, Alana. Honorable Alexandra Humper, CEO of Rare Disease International, distinguished attendees, esteemed colleagues, good day wherever you are. It is with great honor and a profound sense of purpose that I welcome you to today's webinar, where we will delve into a landmark World Health Assembly resolution on rare diseases that holds significant promise for improving the global approach to rare diseases. And I will have the potential to reshape the landscape of global health of people living with rare diseases. I would like to take this opportunity to extend my sincere thanks to my dear colleague, Alexandra Humper, for her tireless efforts in advocating this important resolution and holding this important webinar. Honorable attendees, Egypt is honored to sponsor the resolution on rare diseases that's planned to be presented to the World Health Assembly in May 2025. This initiative reflects Egypt's dedication to improve healthcare outcomes, advancing research, advocating for enhanced support, and improving access to diagnosis and treatment, which is crucial for diseases that are often overlooked due to their rarity. I would like to thank Qatar, Spain, and Malaysia for co-sponsoring this initiative, and we invite all member states to join us and work together to make a difference. As many of you know, rare diseases, while individually uncommon, collectively impact millions of people worldwide. There are more than 7,000 different rare diseases, many of which have no treatment and affect more than 300 million people globally. They often present fundamentally different challenges from those of more common diseases, ranging from diagnostic delays to limited treatment options, and from the scarcity of research funding to the need for specialized healthcare. Since the year 2000, Egypt has made great leaps in addressing the needs of patients living with rare diseases, starting with the screening for thyroid abnormalities and phenylketonuria for the entire birth cohort, and then adding screening for 19 rare genetic and hereditary diseases to another subcohort since 2021. In parallel, several commendable national initiatives were implemented to manage specific rare diseases, such as the Program for Diagnosis and Care of Spinal Muscular Atrophy, Cystic Fibrosis, and Gaucher disease, which represents a robust model of collaboration between the Ministry of Health, the university hospitals, and the specialized research centers. An important flagship initiative is the Egyptian Parliament's approval of a specific law entitled Rare Disease Fund Law, which is perfect model for governance, sustainable financing, and optimal management. Last but not least, significant national efforts are underway to strengthen national capacities, enabling the local production of medicines used to treat or support patients with rare diseases. Like Egypt, many other countries have made commendable progress in meeting the needs of patients living with rare diseases, but this progress has not been consistent across all communities, especially in low and mid-income countries. Egypt's commitment to this cause is instrumental in shaping the resolution. By sponsoring this resolution, Egypt will not only highlight the urgent need for a unified global response, but will also underscore the importance of addressing rare diseases through comprehensive and coordinated global efforts. Ladies and gentlemen, today's discussion is a critical step in this process. We will explore the resolution's objective, discuss its potential impact, and consider how it can be effectively implemented. The objective of the WHO resolution on rare diseases are both ambitious and essential. First and foremost, it aims to enhance awareness and foster a greater understanding of rare diseases on a global scale. By shining a light on these conditions, the resolution seeks to improve early diagnosis and effective treatment, which can significantly enhance the quality of life for those affected. Another key objective is to strengthen the global response through improved collaboration and coordination among countries, and also healthcare providers and researchers till the policymakers. The resolution will emphasize the need for a global action plan that integrates effort across borders to accelerate research, ensure equitable access to treatment, and support affected individuals and their families. The importance of these resolutions cannot be described enough. For many, rare diseases represents a medical challenge and a profound personal and social burden. By adopting this resolution, the World Health Assembly acknowledges these challenges and commits to a framework that supports innovation, equity, and comprehensive care and achieves universal health coverage. Egypt's efforts in this field are a part of a broader vision to ensure that rare diseases receive the attention and resources they deserve. The resolution sets a new global standard and exemplify Egypt's leadership in driving forward health policies that can make a real difference. As I conclude my remarks, I am excited to embark on this journey with you and to hear your thoughts and questions as I explore the resolution's significance. Thank you once again for being here. Let's take this opportunity to drive progress and make a meaningful impact. I thank you very much.
Amazing. Thank you so much, Professor Hassani, for those really inspirational words and for all the work that Egypt has done to get us to where we are today. And we're really looking forward to what's to come. Now I'm honored to invite Dr. Monica Garcia Gomez, the Minister of Health of Spain, to provide opening remarks on behalf of the Ministry of Health of Spain. So Dr. Garcia Gomez, the floor is yours.
Thank you very much. Ladies and gentlemen, distinguished guests, good afternoon. On behalf of Spain, I'm pleased to welcome you to this important public webinar co-sponsored by the Arab Republic of Egypt, the State of Qatar, Malaysia, and Spain. Today, we gather with a shared purpose to advocate for a crucial step forward in global health, the adoption of a World Health Assembly resolution on rare diseases in 2025. Our collective efforts are driven by a commitment to address the significant challenge faced by the more than 300 million people living with rare disease worldwide. Despite the progress we have made, including the recognition of rare diseases on the United Nations 2030 Agenda for Sustainable Development, persons living with rare diseases still face delays in diagnosis, limited access to treatments and services, social stigma, and substantial financial burdens. As you know, as you said, currently over 7,000 rare diseases have been identified, with the 400 most prevalent, affecting approximately 90% of the rare diseases population. However, there remains a long list of extremely rare conditions that often go unrecognized and untreated. This is an urgent issue and requires our immediate attention and action. The United Nations Political Declaration of Universal Health Coverage, adopted in 2019, the reaffirm in 2023 highlights the need to include rare diseases in our global health strategies. The United Nations resolution adopted in December 2021 marked a significant milestone, but to turn these commitments into real improvements, we need a coordinated global effort. Spain, with its ongoing projects and the strong commitment for institutions like the Instituto de Salud Carlos III, is in a good position to boost these efforts. Our decentralized national health system has developed interregional care models, such as the CESUR models, reference centers, that set an example for comprehensive care. Additionally, Spain's active participation in the European reference networks on rare diseases and the implementation of specific digital services through the Ministry of Health exemplify our dedication to improving the lives of those affected by rare diseases. Initiatives like UNICAS, a project that brings knowledge closer to patients and health professionals, which focuses on pediatric rare diseases in collaboration with all the regions, all the autonomous communities, and the important efforts to expand newborn screening programs to 23 congenital diseases by early 2025 further highlight our commitment to this cause. In addition, Spain supports the development of a European action plan on rare diseases, as stated in the Council conclusions on the future of the European Health Union, among other initiatives on rare diseases at EU level. However, we know this is not enough. Despite the great advance on recent decades, there are still many unmet needs. That's why our goal today is to push for support for a World Health Assembly resolution on rare diseases that could eventually lead to an ambitious global action plan. This resolution should raise the profile of rare diseases on the global health agenda, promote equitable access to diagnosis and treatment, and ensure that the needs of these patients are addressed comprehensively and inclusively. Spain, along with our co-hosts Egypt, Qatar, and Malaysia, is committed to boosting this crucial initiative. We believe that through collaborative, multidisciplinary approaches, we can overcome the barriers to care and make a real difference in the lives of those affected by rare diseases, as well as their families and caregivers. I encourage all of you, representatives of permanent missions, policymakers, global health organizations, patients, advocates, and members of the public to participate actively on today's discussion. Your input and support are vital as we work together to advance this important cause. Thank you for joining us, and I look forward to a productive seminar. Thank you very much.
Wonderful. Thank you. Thank you very much, Dr. Garcia Gomez, for those really powerful remarks as well. And thank you to all of Spain's work championing this initiative alongside Egypt and Qatar. Next up on the agenda, we had a representative from the Ministry of Health of Qatar to provide opening remarks. I'm not sure if they're present because I haven't seen their name in the participant list, but I'm just going to give a second. If there's anyone from the Ministry of Health of Qatar here, could you please raise your hand or signal to us so that we can open the floor to you? Okay, it looks like maybe they're having some trouble joining, so maybe what we should do is move forward, and if we see them join later, we'll be happy to open the floor for them during one of our future sessions. So next, I'd be happy to open it up if there's anyone from the Ministry of Health of France here who would like to speak. I believe someone was joining. If anyone's on the line and would like to speak, okay, I see someone raised their hand. Great. Just give us a few seconds to set up the. Oh, okay. I think it's good. Are you able to speak?
Yes, perfect.
Perfect.
The mic is open.
Amazing.
Thank you. Thank you very much, and thanks to the organizers for this event in support of the resolution on rare disease. People living with a rare disease worldwide and their families face common challenges in their daily lives as a vulnerable and neglected population. These are all people who need support to remain fully integrated into society and enjoy full respect for their human rights. This is why France is willing to co-sponsor this resolution. We stand ready to support the efforts toward the adoption of an ambitious resolution in 2025. France has long been committed on rare disease. First of all, at the national level, we have implemented since 2004 multi-year rare disease plans jointly supported by the ministries responsible for health and research, in close collaboration with patient associations. These plans aim in particular to ensure that each patient receives a faster diagnosis, strengthen the structuring of the databases, encourage innovation, and strengthen France's leading role in the European dynamics. At the European level, as Spain said, we are also supporting the desire for a European rare disease plan. And we are really happy that this resolution is going to be a milestone on the international level in the fight against rare disease. Thank you very much.
Wonderful. This is great news. So thank you so much, Nolan, for those remarks and for this great news. We're really pleased to hear that France will be co-sponsoring along with Spain and Egypt and Qatar, and hopefully others to follow shortly as well. So thank you again to all three ministry representatives for their time and their really impactful words this afternoon, this morning, and as well as to all other ministry officials who are joining us on the line from other countries in support of this resolution. So now we'll move on to the next section of our webinar. So we'll hear from some key stakeholders in the rare disease ecosystem regarding their perspectives on the importance of prioritizing rare diseases on the global health agenda, and what role their organizations can take to fully support persons living with rare diseases and work towards universal health coverage. So first up, I'm delighted to introduce Dr. Ghada El Kama from the National Research Center in Egypt. So Dr. El Kama, over to you. The floor is yours.
Thank you so much. First, thank you for the invitation. I'm very honored and delighted to be part of this very important initiatives. And thank you, Alexandra, and congratulations for the RDI on its achievements. The WHA initiative on rare diseases is expected to have a profound impact, of course, on the rare disease community and ecosystem. And it's a crucial step towards creating a more inclusive and supportive system for the patients, ensuring they receive the care they deserve. As all previous participants emphasized of how important the institution, the WHA is, so I might skip to the role of the institutional role. So I come from the Human Genetics and Genome Research Institute at the National Research Center in Cairo, Egypt, where a dedicated team is supporting people living with rare diseases, and we hope we can help supporting the universal health coverage through multifaceted approaches. Possibly we can continue what we're doing, which I would like to enlighten you about what we do at GGRI, or the Human Genetics and Genome Research Institute. Egypt, as we mentioned, rare are not rare. We're having about 100 million or 120 million inhabitants, and we think of about 5% of the population suffering. Rare disorders, we're having about 7 million persons suffering rare disorders, which is the number of a large population of a country. And we have followed about 70,000 persons with rare disorders across the years at the National Research Center at GGRI. where we give a model, we set a model for caring for rare disorders, diagnosis and management, and prevention through several measures: carrier detection, prenatal counseling for the affected and their families. We do this through raising awareness. We organize campaigns and events to educate the public and policymakers about rare disorders. And usually we focus on rural areas with the highest instance of these rare disorders and with the highest instance of consanguineous marriages. And this is a very important problem in our area, not only in Africa or Northern Africa or the Middle East, but in a lot of Asian countries, such as Pakistan, and we're having 33% consanguinity rate, which is not, you might think of it as a small number, but if you think that out of every 3 couples who frequent the clinic, or Egyptian couples, we have 1 who is consanguineous, and this means we're adding to the problem of rare disorders. We also give patient support through, for example, we develop and distribute educational materials, such as a project to develop CDs about simplifying genomic disorders or rare disorders to face the rarity of genetic counselors and clinical geneticists, and to save their time. We have support groups collaborating with our teams, such as DIBRA Egypt and the phenylketonuria, among others. We provide genetic counseling services for the patients and their families, and we provide clinical service and diagnostic service for all-day weeks, of course, through the general and subspecialty clinics, because we're having 9 subspecialty genetic clinics at the HGGRI. We build capacity through training programs. We had with the Ministry of Health, for example, some kind of a survey where we tried to educate the geneticists, the general practitioners, about how to detect a genetic case and refer to a genetic center. And we have been providing lectures to the Ministry of Health physicians, and then we did some follow-up evaluation sessions. We have been educating nurses and general practitioners in the neonatal units about disorders of sexual development cases. It's very important for early detection for these cases and early intervention. We've been planning with H3 Africa and G2MC workshops and seminars and online courses, as well as programs concerned with genetics education for geneticists and genomic workers. For the infrastructure, we've been working through arrangement. We tried to have some kind of arrangement with the National Health Insurance System to build some kind of the HGGRI model, but outside Cairo, to serve the patients there. And we have a good filing system, which we're trying to digitalize. And through this, we might be setting a seed for rare disorders registry to give the policymakers some information about the prevalence and how the problem is in Egypt and which disease is more important to approach and tackle. And of course, to also attract some kind of funding for our research. We also would like to try and convince the government to help us in facilitating data sharing, both on the national and international levels, because without data sharing, it's very difficult to understand or provide management for novel therapeutics for rare disorders. We're collaborating on all levels, both internationally, on the African level, on the Afro-Asian, through networking and through sharing resources, and research facilities. We are seeking continuously funds because it's very expensive to diagnose the patients who are suffering genetic problems or genomic problems, because it's very fundamental. It's part of the very basic necessities at any genomic center to have whole exome, whole genome array, CGH, which we are using continuously to diagnose our patients and also to provide management, such as enzyme replacement, such as as Prof. Hassani mentioned, Egypt is supporting now a lot of very expensive gene therapies for some rare disorders. So we hope through by taking these steps, our organization can play a crucial role in supporting the people living with rare disorders and advancing the health, the universal healthcare ultimately improving the lives of those affected by rare diseases. And we would support, I'm very honored and happy to know that Egypt was one of the first countries to support this very important initiative. And thank you very much.
Excellent. Thank you so much, Dr. Alkama, for those very thoughtful remarks and very tangible results that can come from this important initiative as well. Next up, I'm very honored to pass the microphone over to Dr. Rudiger Kretsch, the Director of Health Promotion within the World Health Organization. The floor is yours.
Thank you so much. Your Excellencies, ladies and gentlemen, dear colleagues, behind every of the over 300 million people that suffer from a rare disease, there is a family, there are friends, there is a story. Often the story contains the long and cumbersome journey to be diagnosed. Often this takes more than 7 years. Very often the treating medical professionals are lacking the adequate knowledge, skills, and means to give adequate support. Universal health coverage means that all people and communities receive the health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. So this initiative is actually a litmus test for what we really mean by universal health coverage. We believe that this is a moral imperative. And so therefore, WHO's guiding principle of our work is health for all and not health for some. Often our health systems are not adapted to rare diseases, and there is little public health policy to respond to the specific needs of people living with a rare disease condition. Access to quality health care, overall social and medical support, effective liaison between hospitals and general practices, as well as professional and social integration, autonomy, and independence. So we know what we need to do. We need to raise awareness, have more and better international cooperation, and we need to exchange knowledge and expertise. But we also need to pool expertise in specialized medical centers and improve access to diagnosis for all people living with rare disease. For doing this, we can use the latest and fast developing IT technologies so that we decrease the inequities between and within countries. To be able to do that, we need agreements between countries regarding cross-border delivery of health services. And we need to regulate remuneration of such services provided by clinics and physicians. Involvement is required of policymakers, clinicians, health lawyers, and financing experts. They need to come together and find solutions. So, dear Excellencies, colleagues, this calls for a global solution. As we have heard earlier, several countries are proposing a resolution on rare diseases for adoption by the World Health Assembly, meaning by all WHO member states. And of course, we as the WHO Secretariat, we're fully in your hands, the hands of member states. As we speak, we are finalizing, however, to support you, WHO's first technical report on rare diseases that is making the case that rare diseases are a public health priority. It will hopefully support member states in their deliberations of a draft resolution on rare diseases. The resolution will make requests to member states, but also to WHO, to the Secretary, to the Director General. As the Secretariat, we do not have an active role in any resolution at the conceptual stage, meaning it is up to member states to discuss and negotiate what they wish to see in the resolution, which would be adopted next May. If you were asking my advice, and I'm speaking in abstract terms, I would cautiously advise against turning the resolution into a long wish list. In this case, it will either not be adopted or not implemented. if, on the other hand, this resolution addresses the basic and most urgent issues regarding rare diseases and is well presented, it will succeed in the implementation. But as we have speakers from member states in the meeting, I'm sure you will be better placed and more relevant in those perspectives. I wish us all lots of success in the months to come. Please know that WHO is ready to support the work for people living with rare diseases, and I thank you.
Wonderful. Thank you so much, Dr. Critch, for those insightful words and powerful message from the WHO. And we're also very grateful for all the support you provide for your activities as well. Next up, I'm happy to introduce our third speaker in this session, James Anderson, who is the Executive Director of Global Health at the International Federation of Pharmaceutical Manufacturers and Associations, the IFPMA, and he's going to provide us with his thoughts. So James, the floor is yours.
Thank you very much, and it's a real pleasure to join this call. I would like to start by just congratulating RDI and the co-sponsors of this resolution. It's such an important and exciting step, actually, and the industry is very pleased to reiterate our full support for the process ahead and following the WHO. It's already been said that this is another step along the way after the UN resolution for patients living with rare diseases, the WHO resolution on diagnostics as a critical part, and the mention of rare diseases specifically in the UNGA declaration on UHC. But we're all in agreement with the need for impactful action, as emphasized by the minister from Egypt earlier. We see the WHO Global Action Plan as a critical tool to level the playing field across all countries in providing guidance and technical support to member states as they create their national action plans and put in place the necessary policies and capacities. In these endeavors, I'm confident that the industry is aligned with all stakeholders on what needs to be done. We're committed to engage with the WHO, with patients, with clinical groups, and to share our expertise in the co-creation of solutions that still are needed to the challenges that have been described, which I will echo several that have been said. For instance, the regulatory methodology and ethical challenges associated with conducting clinical trials for patients with rare diseases. Secondly, the fragmented and under-resourced pathways for patients living with rare diseases in order for them to receive optimal treatment and care, as stated by my predecessor from the WHO, and also already mentioned by the speaker from Egypt, the non-harmonized, non-interoperable registries that are hampering the knowledge because the data that does exist is difficult to access and therefore difficult to leverage. Innovation is also key, and our industry will continue to develop treatments for the diseases where patients still suffer. We know many rare diseases lack treatments or lack effective treatments. And what is exciting within our industry and the broader scientific community is how the orphan drug regulations in the US and the EU are continuing to provide positive momentum to the introduction of powerful new technologies, creating new ways, new modalities to deliver treatments to patients. That's real scientific innovation, and it's continuing, and I believe we all need to be making sure that it does continue, and if anything, is accelerated. We will continue to engage with all the stakeholders along the value chain to better understand the pathogenesis of rare diseases and advances in the fundamental science. And underpinning all of that as well, already mentioned, is the real need for improving newborn screening and the use of diagnostic technologies as the critical first key to unlock the pathway that patients then need to go down. Finally, I would reiterate the long-standing partnership that the IFPMA has on behalf of our members with RDI, and I would mention a current piece of work that we're doing, which is to explore the socioeconomic burden of rare diseases in countries at all different income levels. We all know that the data are rather limited, and so this has been a challenging modeling exercise. But without preempting the publication of these results in the next few months, the early results reinforce what I think many of us would expect, which is that the magnitude of socioeconomic burden from all rare diseases actually is similar across countries at all the different income levels, whether low, medium, or high. We believe this tool will really support the need for the policy and funding and actions that will be determined and described in the resolution, and that will enable policymakers to make the commitments to drive the progress that we seek. IFPMA and all its members will continue to engage with you all in supporting these practical solutions for improving the lives of patients living with rare diseases, while ensuring that the continued collaborations for spurring research, innovation, and better patient outcomes for the patients. Thank you very much.
Great, thank you so much, James, for that message and the role that the IFPMA can play in this resolution initiative as well. And once again, thank you to all three speakers for their time today and their dedication to rare diseases. Next up, I'm thrilled to introduce our panel of RDI members and persons living with a rare disease. We have 4 esteemed panelists joining us today. So we have Entabaleng Ramoli from the Rare Disease Lesotho Association, Nadia Hanim Abdulatif from the Malaysian Rare Disorders Society, David Sanchez from FEDER, and Antoine Daire from Keza Hunter. So we're going to go one by one, but I will pose the same question to each panelist. And that question is, what does the resolution really mean for RDI members and persons living with the rare disease in your organizations, in your communities, and worldwide? And what are some tangible differences that you think the resolution will bring to those communities? So Entabaleng, we're going to begin with you, please.
Thank you very much for having me. And as a rare disease patient myself, I'm going to start from an approach of what this will mean on a rare patient's perspective. Looking at all the countries affected, and Lesotho being one I'm going to talk about the most, is that there is no access to a lot of basic needs, as rare diseases don't affect us from a medical perspective only, but social aspects as well. Because for my instance, most of us don't have one rare disease within our bodies because the complex of the genetics, I'm sure the doctors within the meeting can confirm that genetics are complicated and complex. And some patients are here dealing with not just one rare disease, but multiple in one body. That complexity alone makes it really hard for rare diseases to be contained as per se. And we don't have resources that help us on a daily basis. Financial strain, stigma being one of them, and just overall understanding of such complicated conditions. Now, if we have the resolution implemented, it means there will be legislation and framework that would help people from a very high level, which is the government, all the way down to everyday live people, to actually understand from a bigger perspective what rare conditions actually need. And perhaps we will be in a better space than we are currently. There has been improvement. Let's just take an honor that since 2021, the implementation of the UN resolution to today, there is a lot more, momentum, the more awareness, and people understand where we're coming from. And for that, I want us to applaud the work that's been done so far and not just let it be like, oh my God, nothing's happening. But we can actually improve and more of our needs can be met. there's a lot to go on, but I think the biggest thing that would come from this is that we will be seen. Visibility is a problem in the rare disease community, and just being heard can go a long way, because most people are lying at home being told that they're hypochondriacs when they go to a medical facility with a rare condition. If we could just walk into a medical center and people can take attention and needed push to make sure that rare condition patients are treated like any other person with a pandemic, or like people with COVID or any other condition out there. If we could be taken as seriously, because most of us take about 10 to 15 years to get diagnosed. Some actually just pass on and die without a diagnosis. And yes, those particular topics are hard to swallow, but that's what we live with every single day. That's our reality, unfortunately. That's what we as a community deal with on a daily basis. And as much as, yes, legislation and all these other nitty-gritty things and the medical research will play a role, we all have other issues that are going in on a daily basis. And perhaps the legislation and just the resolution in the entirety of itself will now bring those issues to a minimal, or at least half of them will be solved somehow. I hope I answered the question as
Absolutely. Yeah, thank you so much for those really heartfelt words, and Thabilang. I think that's a really strong message, and I think it echoes true to a lot of groups around the world as well. So thank you so much. Next, I'm going to pose the same question to Nadia. So just to remind the audience, it's, we're talking about what does the resolution mean for RDI members and for persons living with rare diseases around the world in your communities, and what impacts do you think the resolution can have? So Nadia, the floor is yours.
Thank you. Assalamu alaikum. A very good morning, evening, and night for whoever is watching. We are actually a day away from Malaysia's Independence Day. So for those watching from Malaysia, Selamat Hari Merdeka, which is happening tomorrow. Honorable Representative, esteemed colleagues, distinguished guests, I'm really honored and humbled to be part of this discussion, because this has been a long time coming. It's something that Malaysia and the patient groups have been fully supportive over numerous years now, and to see not only the government of Malaysia, but all the other governments that are involved coming together to push for this. And of course, with due advice from Dr. Rudiger when we met him in Geneva, saying, look, make it in bite size so that this is something that the WHO would be able to push through, and the member states, is something that I think definitely is worth applauding. Because we're actually championing a cause that's critical not only to global health, but embodies the very principle of what we mean leaving no one behind when we talk about equity and inclusivity. So the adoption, we believe, of the World Health Assembly resolution for persons living with rare diseases by 2025 cannot come sooner. And this is definitely something that we are fully supportive of. Now, on behalf of the Malaysian patient groups and stakeholders, and we're happy to share now the government of Malaysia, we definitely look forward to not only just a resolution, but an effective and impactful one, as per what Dr. Rudiger mentioned earlier, because global aspirations need to meet real country work. There are many things that are global action plans that are happening out there that must be supported by real actions on ground for it to be truly meaningful for not just the 300 million people living with rare diseases worldwide, but also the 1.3 billion people who are experiencing some form of disability to date. Because the reality of it is many people who live with rare diseases are also people who live with a form of disability. And I think my esteemed presenter earlier had rightly pointed that out. When we're talking about efforts that need to happen, they are womb to tomb. We're not just talking about high-level policies. We're not just talking about countrywide newborn screening. We're going all the way from what about aging and living with rare disease, or rare diseases that happen for late onset, all the way down to how do we assist with premarital or family planning issues, mental health, opportunities for jobs with dignity, education inclusivity, etc. But it's good to start small and start somewhere, focusing on the things that we can do, because at the end of the day, these individuals, ladies and gentlemen, are not just statistics. And I really want to stress this. They are our friends, they are our families, they are members of our community, and I dare say that there are also people within this webinar itself. Because in Malaysia, we always remind people when we advocate outside that we're all going to be less in our ability at some point in time in our lives. So being disabled or being less in the ability that we have right now is not something that will never happen to us. It does not discriminate, but people do. So today we represent nearly 1 out of 4 people across the globe. And when we think about this, the urgency to act is really now. Not only is Malaysia an aging population, so many other countries in Southeast Asia is too. So why would such a resolution matter? For one, we believe it would, of course, strengthen health systems. The resolution, we hope, will catalyze enhancing not only global health systems, but what's happening in Malaysia for PWDs and persons living with rare diseases. We hope that it will help buttress the national rare disease efforts that are already done right now. We have a framework, we have a trust fund, we have a registry. In fact, yesterday, the Minister of Health, as well as the Minister of Science, Technology and Innovation, launched the My Genome project that's looking at collecting about 10,000 genomic sequencing to advance precision medicine in the country and beyond. Additionally, we're also looking at how to tackle the issue of socioeconomic burden, financial strains, caregiver burden for people living with rare diseases, and how this would meaningfully assist those who are the most vulnerable within society. Second, it's about empowerment and equity. At its core, the resolution is really about empowering and ensuring that no one is really left behind. Earlier, Alexandra shared that the United Nations Political Declaration for UHC was already adopted in 2019 and renewed in 2023. Malaysia is very much supportive of this, and our forthcoming healthcare financing policy reform, which the Ministry of Health is looking into right now, will also exemplify our dedication for this, and what more, making healthcare accessible and affordable for all, especially those who are the most vulnerable. Thirdly, it's about promoting multidisciplinary collaboration. We know that complex issues like rare diseases cannot be solved by one country alone. It really does need a global concerted effort. And a WHO resolution would encourage partnerships across the board, not only in terms of health, education, social impact sectors, as well as crucial in addressing the multifaceted needs of people living with disability, as well as people living with rare disorders. And I think in Malaysia, at the end of the day, will align very nicely to the goals that we already have. Not only the Malaysia Madani principles that we have, which includes empathy, but also in terms of policy development, which we hope to launch the National Rare Disease Policy at the end of the year, financial accessibility for those who need not only access to orphan drugs, but allied health and therapeutic interventions, and of course, help position Malaysia in its global leadership ahead of Malaysia as being the seat of ASEAN in 2025. So in conclusion, I believe we stand at a really pivotal moment. And Alana, this adoption of the WHO resolution hopefully will not only signify a global commitment, but it's also a declaration of our collective resolve that if we ensure that no one's left behind in our pursuit of true health equity, then endorsing such a move for a resolution will reinforce our dedication. So I definitely urge all of us, international partners, stakeholders, national leaders, to unite, get on board, because together we can build a healthier and a more equitable world for everyone. Thanks.
Wonderful. Thanks so much for those thoughts, Nadia. They were really, really heartfelt, very inspirational, and I think I also think those echo with a lot of people on the line. So, just before I pass the floor to David, I just wanted to give a kind reminder to attendees on the line to please use the Q&A function for any questions that you have, and to use the chat for any comments you might have. And I see some people with their hands raised. We're going to aim to get to questions at the end of the webinar if we have time, but first we just want to ensure that we have time to get through all our presenters first. So you can also ask your question in the Q&A if you prefer. So now, without further ado, I'm going to ask the same question to David. So what does the resolution mean for RDI members like FEDER and for persons living with rare diseases in your community?
Okay, Alana, can you hear me well?
Yes, very well.
Okay, thank you very much. Well, I would like my first words to be of gratitude. Thank you to Rare Diseases International for allowing us to represent the patient community once again on this way towards the World Health Assembly resolution on rare diseases. And congratulations to Kirsten Johnson for her recent election as chair of the Council of RDI. I would also like to thank all the authorities and institutions who are joining this webinar and who support us on this way. And finally, I would like to say thank you to all the people who help us every step we take in order to change the reality of more than 300 million people living with rare and undiagnosed conditions around the world, including, for example, myself. I live with an inherited retinal disease. Today, we work all together in a coordinated way because we know that no country by its own will be able to address rare diseases without sharing the knowledge available and working in a coordinated way in a network with other territories or countries. Because of it, rare diseases were almost unknown 2 or 3 decades before. And patients and families decided to change it. We created the first organizations like Eurordis or FEATHER in the 90s. And since the beginning, we worked in a coordinated way beyond any border. And that's the reason why we are today here. There are many precedents, the first policies on rare diseases, the International Research Consortium, or even the UN resolution in 2021. Global initiatives for global programs to leave no one behind. However, despite this progress and solid frameworks as the UN resolution, there are still many parts of the world where there is still no definition for a rare disease. This is the case, for example, of many countries in Latin America. Despite the international efforts, for example, in Europe with the European reference networks, we currently have a lot of challenges. If we talk about, for example, diagnosis, in Spain, for example, the average time to get a diagnosis is 6 years, but it is almost a decade in Latin America. If we talk about treatments, only 6% of those more than 6,000 conditions, rare conditions, have it. And of course, inequity to access to diagnosis and treatments, it's another huge challenge. The World Health Resolution will help us to focus on people living with rare diseases. It will allow us to develop the measures included in the UN resolution, urging countries to carry them out. It will improve resources and there will be more research and more treatments and a better healthcare. Sharing resources, expertise, information, collecting data, it will provide us a better picture of the magnitude and difficulty of rare diseases. And it will allow us to enable the measures to reach an equitable access to health resources. In Spain, we have the commitment of our government and our Ministry of Health. They have historically supported us, and especially since 2009, where a rare disease strategy was implemented in our national healthcare system, and which is being evaluated right now. But Spain also co-sponsored the UN resolution in 2021, and now with Egypt, Qatar, and Malaysia again. So we would like to thank all of them for this. And from FEATHER, we are really grateful and proud of the support, for example, of Her Majesty the Queen of Spain in all the events she participates. And as well, we are really grateful to Monica Garcia, the Spanish Ministry of Health, who joined this webinar. But in Spain and as in the rest of the world, there are a lot of challenges to address. And we think that this resolution will help us to face them. Today, I would like to underline that the impact of this resolution will have a huge, will have important things for places where there is no definition for a disease, there are no records, there are no plans, nor global frameworks of regulation, places like, for example, Latin America. So we need the commitment of everybody for justice, for human rights, because all human beings have the right of spending a good life. So let's work all together in order to provide or improve the quality of life of people and families living with a rare or undiagnosed condition around the world. Thank you very much.
Amazing. Thank you very much, David, for those important thoughts as well. And RDI certainly agrees that we very grateful for Spain's involvement as well and everything FEDER has done to help us as well.
Thank you.
Yeah, great. So next up, I'm going to once again ask the same question to Antoine from Casa Hunter in Brazil. So what does the resolution mean for Casa Hunter and other patient organizations, and how do you think the resolution will truly make a difference?
Thank you. Dear friends, I would like to extend my sincere thanks to RDI for the invitation, and particularly on behalf of Brazilian patients, I wish to congratulate the Ministers of Health present here today for their public commitment to this cause. It's an honor to be here. In a very concise way, as a president and founder of Casa Hunter, and also as the president of the Brazilian Federation of Rare Diseases Associations, I would like to highlight 3 key reasons why we trust and advocate for the WHO resolution on rare diseases. Firstly, it's fundamental to emphasize the need to focus on rare diseases. Only through this effort we can succeed in developing global policies such as expanding the newborn screening and creating specialized models and care centers equipped for the multidisciplinary nature that rare diseases require. It is always important to remind everyone that the world often overlooks the fact that rare diseases are one of the leading causes of childhood mortality. With national policies supporting the expansion of newborn screening, we can significantly reduce childhood mortality rates. Secondly, the World Health Assembly's endorsement will support the struggle of rare disease patient groups worldwide, opening channels of dialogue within United Nations members countries that are not always receptive to the cause of rare diseases. This, in turn, will help millions of patients who are suffering. Finally, the World Health Assembly resolution on rare diseases will address the crucial topic of health technology assessment globally. This is a challenge even for wealthy nations due to the specific demands for scientific investment and the need for adjustment in hospital infrastructures today. It's important to note that modernization and innovation across all areas of medicine are closely linked to research in rare diseases. We must also remember that we are in the era of precision medicine, and it's crucial to acknowledge that the catalyst for transformation and innovation in health was the investment and research for rare genetic diseases. In closing, we, patients and caregivers affected by rare diseases, are here not only to defend our rights, but more importantly, to contribute to a new global health ecosystem for a better day, for a better life. Thanks.
Thank you so much, Antoine, for your remarks and for those really important insights in the resolution as well. And once again, I'll just extend a heartfelt thank you to the whole panel for their esteemed participation today and for highlighting the significance of the World Health Assembly resolution on rare diseases for the entire rare disease community, which we think is a really important perspective to bring. For all the panelists, I invite you to please stay on the line if you're available, because we will hopefully get to some questions at the end, and they might have some specific questions for you. So I invite you to stay on the line if you're able to. And this brings us to the final session for today, where we'll hear from some champions in the rare disease field who will provide their brief reactions on what has been said so far in today's presentation and some of their perspectives. I will just kindly remind them to please keep their remarks bold and concise to ensure we have time to open the session up to questions from the audience at the end. So first up, I would like to invite Anders Olofsson, the founder and director of the Argenza Center in Sweden, to provide his reactions.
Hello.
Hello.
Do you see me?
I see you. I hear you. It's all good.
Fantastic, fantastic. There have been so many feelings. There have been so many reaction in me. Listen to all the fantastic intervention. I must say, I really want to congratulate RDI and your members and your community for making this effort and what you've done today. It feels like we're talking about the global strategy, the need for a global strategy and resolution. And it feels self-evident. We have to have one because the world consists of so heterogeneous countries and situation worldwide. So the only way we can do it is to do it together. And I feel that David from FEDER and Rudiger really put the finger on to say that no one can do this alone. We have to do it together. We have to find and share experience, listening to the people who, with their own experience, say that. We have to share that. We have to share the knowledge. We have to share the legal needs, the need for legal changes in the countries. And we also have to put of effort on the diagnosed, who are listening and looking for all the people who are undiagnosed with a rare condition. So I think listening today has filled my heart with hope and feel that we really have a way forward. I'm so happy and to listen to all of you and the supporting countries. I really congratulate both of you, no, three of you, from Qatar and from Egypt and Spain. Spain again, and hopefully, and I'm very happy as a Swede, we have a queen here as well, who is the champion together with the Spanish queen. So hopefully we can do it again. Thank you very much.
Wonderful. Thank you so much, Anders, for the brief but very powerful reactions as well. So next up, another rare disease champion on the line. I'd like to invite Carmencita Padilla, a national scientist with the National Academy of Science and Technology in the Philippines, to provide her reactions and insights.
Good evening, good morning to everybody. So allow me first to thank RDI for this commitment to lead all of us to put patients and with rare diseases in the limelight. I'd like to thank the countries.
Carmencita, sorry to interrupt. Your sound is too low. Please try again.
Okay, is this better?
Not so.
No. Is this better?
Then you have to kind of be quite loud. Sorry about that. Try again.
Okay, so is this better?
A little bit, yeah. It's quiet. It's quiet.
Okay. Okay, first, thank you to RDI for the commitment to lead all of us to put the patients with rare diseases in the limelight. Now, thank you the country sponsors, and I wish my country is one of the sponsors, but it is not yet. And I think we have to move all of our ministries towards this direction. So the resolution will definitely set the global standard for quality care of a deprived sector of society. I am personally torn between having a comprehensive WHA resolution versus the suggestion of Dr. Rudiger Kretsch to keep the resolution brief, basic, and with a bigger chance of being approved. And I will leave that to the community to decide. Now, the Philippines has expanded newborn screening, covering 29 disorders, and a lot of them are genetic rare diseases. And this is implemented in 7,200 hospitals, 7,000 hospitals in 7,000 islands, with coverage of 95%. But it does not include patients with other rare diseases who are diagnosed much later in life. As a clinician, it is very challenging, and I'm sure this feeling is shared by fellow champions from LMICs and LICs. So definitely we need the global action, we need the WHO resolution, and we have to do this together. Thank you.
Wonderful. Again, thank you so much, Carmencita, for the brief and very inspirational thoughts as well. So next up, I'm happy to invite another rare disease champion we're happy to have with us today, Helen Sederoth, the founder and chair of the Willem Foundation, to provide us with some of her thoughts and perspectives.
Yes, thank you for inviting me. I'm very honored to be here with you today, and such a wonderful meeting. I think that this has been a very positive meeting, and I will tell you all that I'm represent the undiagnosed people living with undiagnosed diseases, since I'm a mother of 3 children who died from an undiagnosed disease. And then we founded Willem Foundation. And we are Swedish-based, but we are working globally for all the undiagnosed people. And I think it's so great today. And Anders talked, when Anders told, I can just echo him, that we have to share and we have to come together to solve these undiagnosed diseases. And I like that Rudiger told us that we have to work together, and we have to that health for all. Since the undiagnosed families are left behind, they don't have any diagnosis. They don't have the key to the solution. They don't have the key to medical, to treatment. They don't have to treat any key at all to unlock the pathway of the undiagnosed diseases. And therefore, we know today that 60% we can't solve today. We can solve 40%, and therefore we have to come together globally to work to try to solve these unsolved diseases. And I think that with this solution, we are on a very great way for the undiagnosed around the world. And I think it's a light day and it's a happy day today. And I'm very honored to be a member, that Willem Foundation is a member of RDI, and I will thank you all, and thank you all the countries. And I hope that Anders has read right, that the Swedish Queen will also soon work for this, so we are members from Sweden. And thank you so very much.
Thank you, Helen, for those remarks. Very heartfelt as well, but I think very impactful. Lastly, well, next up, I'd like to invite Dr. Anna Rath, the director of Orphanet, to share your reactions to what's been said so far.
Yes, thank you very much. Can you hear me well?
Yeah, I can hear you and see you. Perfect.
Yeah, so thank you very much for giving me the opportunity to react to this inspirational meeting, and I will echo my colleagues on being so grateful to RDI having organized this webinar and pushing for this the WHO WH Assembly resolution. So I think that we are facing an unprecedented opportunity to act global, to impact locally. And I really want to stress that global for local, because I think that it is really the way to go to reduce inequities. And I will take just one point recommended by Dr. Rudiger, Craig, that is the diagnostic delay that everybody has discussed about today. The diagnostic delay is also a delay in recognition on existence as a person living with a rare disease, and that is a subject that is extremely close to Orphanet's heart, as you know. So globally, we need to have a framework of approaches and of tools that can be adapted adopted and adapted at the local level to what? To raise awareness, to empower, and to ease the access to the expertise. For whom? For primary care and primary line health professionals. I think that a real impact will be made if we target this population of practitioners, not only doctors, but that implies that health systems are prepared to better integrate the non-specialized sector with the rare disease specialized sector when it comes to rare diseases. And here is where a global plan for, or a global policy for rare diseases can have a real impact on reducing the inequities for people living with rare diseases. So this resolution is a key milestone towards that. So thank you very much, and congratulations for this nice webinar.
Great, thank you so much, Anna. Lastly, I think we have a little bit of time, and I noticed we have Virginie Brosse-Fasser, the CEO of Eurordis, on the line. So if you're available to give some of your brief reactions as well, that would be much appreciated.
Thank you very much to RDI, the co-host, and also thanks to all the inspirational speakers. It's been genuinely a really insightful webinar, so important to highlight from the different perspectives why a World Health Assembly resolution on rare diseases is needed. So I heard many important key messages, but I just wanted to maybe highlight a couple. So first, following the lead from Spain and from France, but also from my European perspective, I truly hope that we will be able to see more European countries mobilized soon for around this resolution. I'm very much looking forward to reading, but also disseminating to the European rare disease community the WHO technical report on rare disease, which will further help in spreading awareness of the challenges of people living with a rare disease across the WHO regions. So we also heard about the need to foster innovation on one side, and also improving equity of newborn screening programs on another side. And there are so many pilot initiatives ongoing or in planning on genomic newborn screening today across the world that it's important to use the momentum of the resolution, but also the action plan to bring those aspects to the forefront of public health agendas. So today really helped us to better understand the power this resolution has to act on as both a facilitator, but also a catalyst for global action that will enable systemic improvements for people living with a rare disease. We all know, understand here, you know, we heard it many times how much these improvements are needed across the regions, including in Europe. But it is thanks to initiatives such as the one today that we will be able to scale the communication and extend the reach to all member states for global support. So thanks again, everyone, and I pass it on to the next person or for questions maybe. Thank you.
Perfect. Thank you so much, Virginie, for those thoughtful insights, and to everyone who provided their perspectives and reactions today. Now I'm going to pass it over to our CEO again, Alexandra Humbert, to provide us with some closing remarks and start to wrap up the session and summarize. So over to you, Alexandra.
Thank you, everyone. I'm not going to be long because I would like to give some time actually to Professor Hassani from Egypt to close the meeting, and to the chair of RDI, Christine Johnston. But I just would like to react to what has been said today. First, it's extremely encouraging to see the member states that are calling in one voice something tangible from that resolution, echoing Dr. Rodriguez from WHO. Again, we do not want a resolution full of principle, full of action that at the end will stay on shelves, but we want something that will provide a framework for action. So the resolution can be very straight and can ask the World Health Organization to develop that framework for action in consultation with all member states and civil society. It will be a game changer. There will be a long consultation process where we will be able to talk from research, going through diagnosis, newborn screening, access, and even stigmatization and mental health. So this is exactly what our members are also calling for today. So thank you for that. I think it's extremely encouraging. I think we are on the same line. It's a huge milestone already. So I pass over now to Professor Hassani again to make the closing remark. I remind that Egypt is the lead country for this process, is the one that initiated that resolution. So thank you, Professor Hassani.
Thank you very much, Alexandra, for your ambition and for your leadership in advocating for this important resolution. And thank you very much, Elena, for the excellent moderation of this important webinar on this exceptional day. It was truly inspiring to hear from a representative of member states, the WHO, the field experts, and definitely other stakeholders. I would also like to express my profound thanks to France for co-sponsoring the resolution. And with this momentum, I trust that more countries will jump inside this process and also having other countries co-sponsoring the resolution in the coming days. Again, I am fully aligned with you, Alexandra. Dr. Krish advised us to avoid creating an extensive wish list and to strike a balance between realism and optimism. And this perspective is absolutely valid, but we must remain focused on our ultimate goal of achieving equity in healthcare services to rare disease patients. And it's essential to encourage different healthcare systems to consider the need of patients with rare diseases from various angles, as these patients deserve to live without suffering. Today, we had the privilege of exploration of the WHA resolution initiative and examining it from multiple perspectives, which will undoubtedly enhance the value of these resolutions. I would like also to commend the efforts of RDI in leading this remarkable goal and advocating for this resolution, which may serve as a candle of light in a tunnel of darkness for those patients with rare diseases. As we conclude today's enlightening and impactful discussions, I want to extend my deepest gratitude to each of you for your valuable contributions and engagement, and wishing to meet again very soon when we celebrate the successful adoption of this resolution and consider it as a valuable preparatory step for changing the face of management of rare disease patients. Thank you very much, and back to you.
Thank you, Professor Dr. Hassani. It's an absolute wonder to have so much support today. I've been overwhelmed by all the regions of the world being represented, all the voices being represented, having the passion from the policymakers to the patient advocates, to the researchers and the scientists, the global health advocates, the whole community coming together. It's just amazing. So I thank all of you for your time, for your enthusiasm for this project, and for the momentum that is now building. So thank you to Egypt for being the first sponsor, the main sponsor of this. Thank you to Dr. Gomez for your words from Spain and for Spain's sponsorship. Thank you so much to Dr. Leon from France and for France's sponsorship. And we thank Qatar and Malaysia also for being co-sponsors. To have 5 countries already putting their names on the line and the political will that it takes to do that, we are very grateful and we recognize what you have done on our behalf. I myself live with a rare condition, the Fragile X premutation, and I represent the rare cancers because my husband lives with a rare cancer. So I have firsthand experience of how something can be so powerful when you have the political will behind it. And we thank you from the bottom of our hearts, Rare Disease International, and all the communities that we represent for making this happen. So I join all of you in looking forward to the next steps in building towards this World Health Assembly resolution in 2025. And we will look forward to this resolution setting out the need for a global action plan on rare diseases that address a holistic, integrated approach to rare conditions so that no matter where anyone lives in the world, they can experience equity and inclusion and live the best life possible. Thank you all so much for your support, and I wish you a very good morning, afternoon, evening, wherever you happen to be. Thank you.
Oh, Alex, you're muted, Alex. Yeah.
Go away.
Good now.
Okay, cool. Okay, so we have 3 minutes left. I just wanted to acknowledge all the participants. We had at one point more than 265 participants, and we saw in the list a representative also of ministries of health, notably Chile, Germany, and others. So we are very eager to continue the work with all the different countries. We have members, as you heard from Virginie, from RDIs that are eager to again make sure that their countries are on board, also Brazil, Lesotho. So we are very encouraged. Thank you all. If anyone have questions, comments, wants to know more how to be involved, please do not hesitate to contact RDI team. We had put some of the email in the chat. And again, thank you all. Thank you, Alana, for your extremely impactful, well-organized webinar, and all the team of RDI also. Thank you, Professor Hassani. Thank you, France, my country. Thank you, Malaysia, Qatar, and all the speakers. And Spain.
Thank you.
And Spain. Thank you. Thank you.
Thank you very much.
Thank you, everyone. Have a great day.
Thank you.
Thank you very much.
Birthday.
Thank you very much.